for the assessment of the head, eyes, nose, mouth, throat, and ears. For the course NU 650, which is Advanced Health Assessment. Anna, do you give consent for me to record this video?
Yes.
Trying to see certain nerves that are in the face and see the asymmetry of that. Okay, now turn of the ear. We're going to check it out, the helix, anti-helix, in the inside of the ear. In order to do that, we're going to see if we can see any kind of secretion from the medium canal, the fork, the vibration fork, so we can examine the air conduction and the bone conduction. Both can tell us if she has any kind of problems to hear. In order to do the air conduction, we're going to make this, and then we'll try to see if she can hear the vibration of the tuning fork. If she says yes, that means that she is able to hear in both sides of the ear. Can you hold your hand here? So we are going to do the same thing with the tuning fork to see if she can hear. Then we ask her if she hears any sound, and then we're going to do the bone conduction, which we make the tuning fork to do the vibration, and we put it in this area of the mastoid bone to see if she can hear, or she can hear the vibration and the sound of the tuning fork. Stay in the back of her ear, and we are going to whisper some words like, what color is your nose? So once we whisper, we see if she can hear in both sides, like, what time is it? What time is it? And by whispering, we can see if she has any kind of problems with the to hear. We have to take our otoscope, we turn it on. We turn it on, and then we are going to check the medium ear. In order to do that, we are going to see first if you can see any kind of secretions. Do we see any kind of obstructions for the medium canal? If we can see if there is any kind of erosions in the medium canal, and we do in both sides of the ear. So we see if she has any kind of obstructions. In order to do that, we're going to pull up and back so we can see most of the ear. Once we check that there's nothing there, we can go inside the ear to look for some certain things. So as we go inside, we try to see the ossicles, which are the little bones which are in the very back, and we can see if we can see the tympanic membrane. And we are going to see at the end of the canal that there is a little light. That light is the reflection of the light. The tympanic membrane, we see the ossicles, which is the bones that mean the inner ear. And also we see if she has any kind of obstructions, any kind of foreign bodies, or any kind of lesions inside the ear. In this case, everything is okay. Eyebrows, see if the head is without any problems. Then we're going to see the eyelids, and we're going to see if there is no inflammation. Ducts that give some kind of lubricant to the eyelids. In order to do that, we're going to see if there is no masses. Then we're going to try to see the lacrimal sac to see if there is any obstruction to the lacrimal sac. But you can see maybe like a 2 or 3 millimeters from the inner to the outside in the lower palpebral. Then we're going to see the sclera to see if there is any change of color. So in order to do that, we have to try to see inside the eye with both eyes, see if there is any change of colors. Then we see the cornea to see if there is any kind of, open your eyes, to see if there is any kind of opacity in the corneas and also in the sclera. After that, we're going to evaluate the visual fields. In order to do that, you can put your hands on her back and ask her, look at your left side and tell me when you start to see my fingers.
I can already see them.
Okay, so this is the way that we evaluate the visual field. Now let's see with the other hand.
I can see them.
Right here?
Yes.
My fingers?
Yeah.
What I'm doing right now?
You're moving your thumb.
Yes. Okay. So with that, we have an idea how is her visual fields. And then we ask her with one finger to follow my finger. So we are going to see the muscles of the eye to see if they move together. If there is any kind of strabism, and then see if she has her vision, her eyes follow the fingers at the same time, so we can see any kind of pathology. Go up, we go down, we go to the sides, both fingers. Once we do this, we can see if the muscles, there are three specific nerves that we're evaluating here. The third, the fourth, and the sixth nerve muscles. Okay, now we're going to ask her to see, we're going to see how her pupil reacts to the light. In order to do that, we have to turn on all the lights, and we are going to focus in one with my otoscope to the eye, so you can see how her pupils will react. And we will see that the pupil constrict or dilate as the light hit her. And then we have to see the other eye. And then we see if both eyes have the same reaction, even though we are hitting only one eye. Turning on the otoscope, we're going to start with 0. And then we are going to move the otoscope to graduate for me. So I ask her to see one spot in front of her. Something like this. So you pointed some fixed point in front of her, so she has to look that point. This exam has to be with dark room, but because we are videotaping, we are not going to turn off the lights. And so as we ask her to fix her eyes in one spot in front of her, we're going to see almost 45 degrees for her, try to locate what is the pupil, and then with my right hand, I'm going to see with my right eye, and I'm going to see her right eye. So once we start to go in, we are going to move the disc in order to see what we can see. Then we are going to see that there are arteries. Don't close your eye. We're going to see the arteries, and we are going to try to localize the arteries and follow them. So we can see the contour of the artery. We see if there is any vein. Most of the time you cannot see the vein, but you can see the artery. You see the shape. You see if there is any spot. If there is any, if the edge of the artery is not neat. So all those abnormalities mean something. Also, we are going to see besides the arteries, we try to see if she has any kind of like a cotton consistence in the retina. And then after you try to see most of the retina area, you're going to follow the artery in order to hit the fovea, which is where the optic nerve comes from. So we grab that artery, we follow it, and then we're going to see a white big spot. That's the phobia. You got it, huh? You were like a blind for 1 second. Huh? Yeah, because that means that you were able to see the phobia. Okay, and the same thing you will do with the left eye. But in order to do that, you're going to grab the otoscope with your left hand. You're going to see with your left eye, and you're going to see her left eye. Once we finish with the eye, we are going to see the nose. The nose is a little more simple because there's not too many things to see. We're going to see we have some kind of abnormalities in the side of the nose. Then we are going to see if there is any bump or there is any secretion from the nose. So in order to do that, we just go like this and try to lift the tip of the nose. Then we are going to check the frontal sinuses and the paranasal sinuses to see if there is any kind of discharge, if there is any kind of bump, and if there's anything that give us the clue that she has some problems in the sinus. Once that is done, we are going to grab the otoscope, but now to see the nose. In order to do that, we are going to turn around. We are going to grab the tip of the nose, move it upward and backward, and then we see if there is any obstruction, if there is any mucus, if there is any kind of erosions that can give us some kind of pathology. For sure, we have to put this area of the otoscope inside the nose, but we are not going to do it today. But this is the best way to try to check it out if she has any kind of problems inside the nose. The last part of the test in the neck, in the toes. In order to do that, we can use the otoscope without nothing. We ask her to open the mouth. We ask her to open the mouth. We lift it a little bit, and we have this tongue depressor. With the tongue depressor, we can see the mucus. We try to see the parotid duct. That how, if there is any problem, you will see that it's going to be inflamed. Then we see the gums, all the gums of the mouth, and also the upper gums. We see the upper mouth, upper gums. Then we see the front part of the lips. We see the teeth, if there is any problem. Then we have to see the tongue. So we ask her to put out the tongue so we can see the papillas. We see if there is any asymmetry or if there is any swelling in the tongue. Then we see the soft part of the mouth, where we're going to see the uvula to see if it's symmetric or if there is any kind of asymmetry in the fundus. If there is any kind of mucus or patch that can indicate something. Then at the last we see the tonsils. In order to do that, we use the pressure tongue. We ask her to say a few times so we can see both tonsils if they are inflamed, if they have any kind of pathology. When we finish with that, we're going to see the neck as the last part of the exam. So for the neck, we see the asymmetry. We try to see the thyroid, which is in this area, the thyroid gland. And also we are going to palpate if she has any kind of ganglia. So we see the occipital ganglia right here. Then we go for the periauricular ganglia. Then we see the submentorian ganglia, the paracervical ganglia, the superficial ganglia. And once we see that she has no ganglia around, we see the symmetry of the sternocleidomastoidea muscle to see if there is any problem there. Then we see the thyroid, which is right here. We see if there is symmetry. We can see that there is any kind of deviation. And try to palpate the thyroid gland, which is in the very base of both sides of the toes. When we finish to do that, the exam is complete. Thank you.